In this video, we will discuss about Leishmania tropica, which is responsible to the disease called as cutaneous leishmaniasis or oriental sore. Dog and man act as the natural host, and the location of this Leishmania tropica is skin and endothelial cell of the capillaries of infected area. It is transmitted by Phlebotomus sargentii vector in India. And the pathogenesis involves after the promastigote stage introduced into the skin, they are engulfed by the macrophages in the skin, where they multiply to a mastigote form. Then the rupture of macrophage is there. At the site of the infection, there is infiltration of the lymphocytes will be taken place, and epithelial acanthosis, hyperkeratosis, necrosis, and shallow ulceration can also be noticed. Clinical signs involves dry cutaneous form, ulcer or sore formation. Then initially they resemble the mosquito bite, and they are reddish papule with vesicle formation. Itching may occur, and a permanent scar is left after the cure. And lesions may join to form a large ulcers. And in former USSR, that is in present Russia, there is moist type of cutaneous leishmaniasis is also encountered. There are three stages of the pathogenesis involves initially formation of papules and nodules. They are non-ulcerated and superficially heal without scarring. And the next stage involves the formation of macules. They are raised ulcerated bluish red margin with uh, no secondary infection. They heal and leave a scar. And the last stage is relapsing form, where low papules resembling leishmaniasis is seen. This is the cutaneous lesions on the snout of the dog, and this is oriental sore on the face of child. This is amastigote form, and this is promastigote form. When it comes to the immunity, there may or may not be the cross immunity between the two species, and spontaneous curing of Leishmania tropica leads to the major immunity protect against the reinfection, and solid immunity occurs which lasts for several years. It can be diagnosed by scraping the edge of lesions and making the smear and a staining, where we can find the mastigote form. Then biopsy of the lymphoid organ, then culture in the triplan medium, and Leishman test. It can be treated by using sodium histogluconate, and the control aspect is similar to the Kala-Azar. Next species is Leishmania brasiliensis, and it is responsible to the mucocutaneous leishmaniasis. It is also called as Espendia, and the vector which transmits this Leishmania brasiliensis is Lidzomia, and the host is man. And the next species is the Leishmania